Are they your best buddies or just buddy?
Best buddy.
Best? Just?
That's a situation dependent. Very good. That's it. So those who didn't raise their hands, let's hear from this track some best buddies of nurses. So to chair this track, may I now request Ms. Sino Thomas, member ANEI, to come on the stage along with the best buddies, Ms. Vasu Srivastava, GM HR AIG Hospitals.
Let's invite them a huge round of applause.
I can't hear the applause. Just now you all had your lunch, right? Some motor activities in the hands? Yeah.
People at the back.
Next we have Dr. Anil Kumar Mulpur, Chief CT Surgeon, Apollo Reach Hospitals, Karimnagar. A round of applause for sir. Dr. Sanjeev Sharma, HOD Clinical Pharmacology, Apollo Indraprastha, New Delhi. Let me introduce our chair to you. Ms. Sino Thomas is the Group Head Nursing of CTSI, South Asia, which is a company owned by Siemens Medical System USA. Over 20 years of experience in healthcare, quality, nursing operation, process improvement, and many more. Madam is Hyderabad chapter head for INS and Infuse, and she is also the auditor for Infuse with INS. She has worked as head of nursing for Aster, UAE, and Bahrain. Welcome you, ma'am, to chair the session. May I request you to kindly lead the track?
Thank you so much. Good evening. Good afternoon. It should be a good morning, please. Most of the time I get the last track and I don't know why it is like that. I always feel the audience should not sleep because I am sometimes very fast and in my speed sometimes people will feel, let me just take that nap. Please don't do that to me. I request all of your attention here. Our girls who were doing a very good campaigning for 2 days, overdosed it now I think. They just asked all of us, right? Have we got buddies, right? Have we got buddies in our workplace, right? And I'm very sure all of us over here yesterday and today have got a lot of friends today, correct? And we have exchanged our numbers, we'll be going back, and when we talk and discuss with ourselves, we will be discussing about our agendas, those things which are around us all the time, right? Unless, like we yesterday learned from Tangam ma'am about siloing ourselves, we will not be able to come out of the places and then not look at a bigger picture for it, right? Because we all want to grow as individuals. Growth will not be only possible if we are going to be just moving in a direction of what we know, right? Because we all have to get there. We heard a lot from all the eminent speakers on different aspects, right? So let me just, introduce through the definition. Buddy is an informal synonym for friend or a close companion. Now today we are going to understand, there are many buddies in our ecosystem, right? And in this forefront we will take up the three main buddies which are critical for all our roles. One, HR, as we see here, multiple things around us through HR. This is a clinician, Every time the patient is asking, when is the doctor going to come? Yes, he is going to come. There are many more things, you see. Sometimes you have the clinician shouting at the nurse. Sometimes you have, an ineffective or unsatisfied clinician at all times. This is just one part, I'm sure you will put the positive part of it. So these are some challenges which we all have, right? And they are living with us, right? 8 hours of shift, 10 hours of shift. Clinicians are the main buddies, right? Operations by itself, and this is the pharmacy, yeah? Every time that we are interacting with, waiting for the medications for his own time. And this is we. If at all anybody doesn't be with us, we are very much ready around this. Don't play with me, I'm very sure that, I'm going to make use of the whatever equipments I have with. So this is us, okay? So with this being in mind, let us see, there are so many things in nature which will also help us to understand. In ecosystem, it's not just the human beings who are expected to be, living together. There are animals also who can teach us, what happens. And I want all of you, fresh minds who are here, to go back to the biology sessions and please help me to understand what is this relationship called. Have you ever seen this? Nemo? Yeah. And how does it help? They have those corals there. The waste helps the ecosystem around it to grow, And he, the Nemo itself gets the protection around it, right? They live together. These images, yeah, there are so many birds who are around giraffe. Giraffe is a very, very, gratitude-filled animal. It allows anybody to sit on it with that high neck there. Very high in head, but it allows all the birds to sit on it. What happens is, these birds eat all those parasites which would probably cause diseases to giraffe, and in turn they are exchanging a very healthy relationship. Similar with the buffalo. You see this Mana there. They also exchange this. What is this relationship called? Symbiosis. Thank you, ma'am. Thank you so much. I thought people will talk from back also. So this is symbiosis. Yeah. Symbiosis is made up of two Greek words, which means within and living. Sym and living, biology. Yeah. So with this context in place, we are going to look at the operations and systems from a new perspective. How do we ensure and how do we have our buddies speak to us? I take this privilege to welcome Ms. Vasu Srivastava, who is the GM HR for AIG Hospitals, Hyderabad. She definitely has a healthcare background. Also, she has a vast experience in media, from 1999 to 2003. Yes, thank you. With all the cloud in place, she is one of the 50 women achievers in building the innovation ecosystem in 2022. She has contributed towards achieving the excellence of women safety and well-being by society for Cyberabad Security Council in 2023. HR Excellence Award for the Best Practices of HR in 2017. Apart from that, if you look at it, she has also worked as an active member for the Indian Women Networking CII and member of Indian Diversity Forum Wellbeing Council. Now, how does this help us is to understand different perspectives of HR and how all those perspectives are going to ultimately help us. This diverse experience around of hers is going to especially help us to understand how we all will be able to get the benefit out of it. And as nursing heads, budding nursing leaders, how can we ensure that we make use of this buddy to the most? Welcome you. Thank you.
Good afternoon. Good afternoon. Wow, that's great. I'm very comfortable today because I could see a lot of buddies sitting here because I have worked with them earlier, or maybe in one of the conferences I have interacted with them. So the most comfortable presentation today, because it's not a presentation, of course, it's a talk, because so many buddies around me sitting here. So thank you so much for giving that comfort while I share my belief and my opinion. In this intricate world of healthcare, there are two vital players, HR and nurses. So the story begins. HR earlier, so if we talk about the HR function earlier, HR was mostly a very closed function where I have heard people talking about HR as a personnel function. We used to sit in a closed room, used to make the policies, documentation, and taking certain decisions based on the instructions given by nurses. Do this, okay madam, doing it. Do this, okay, we are still doing that, but we are doing with the nurses. We are partnering with our nurses. So today what we are doing is not for the nurses. Today what we are doing is with the nurses. So that's a definition and that's a transition of the HR from, I can say, 20 years back and what it is today. Strong buddies, yes, if we are partnering with our drivers, and nurses are the biggest drivers in the business, in the healthcare business. Although most of the talk I have heard, nurses were saying that they are at the back end, or probably they take care of the patient services, they are not a part of business. But I strongly feel that you are very much a part of business, because the services which you are giving to our patients, that gives a holistic approach of the services, the definition of services. So that's where it comes, and when we work with our nurses, we create that foundation and we create that structure of giving the kind of environment in the hospital and the best of services for this healthcare industry. Of course, I am not going to elaborate on what we can achieve when we work together as a strong team, because we've seen in a lot of places where we work together, what are the results. It's very much evident. Few things which I'm not just going to talk, I'm not going to read slides, but then few experiences I'm going to share. See, there is a common objective. HR and nurses, they share a very common objective of creating a very conducive working environment and a compassionate environment at workplace. In terms of it starts right from the time when a nurse is being hired in the organization, hand-holding a nurse, creating a kind of system in the organization along with the nurses, creating that comfort or giving that comfort right from the time when a nurses join the organization, in terms of providing best of the hostel facilities, in terms of, because most of the nurses who join, the young nurses who join, they leave their families, they leave their hometown, and then they come and join the organization. So it's our prime responsibility to take care of them at that point in time, just to ensure that they are settling well in the system. What are the feedbacks we are taking from the nurses to ensure that they are settling well in the system? What are the suggestions they are giving to us to strengthen that bond, to fill up those gaps which we can do together? And the onus of responsibility lies on all the nursing leaders as well as the HR. Because when we say that people are leaving the organization, people usually don't leave the organization, people leave the bosses. They are not particularly very comfortable, they leave the culture because they feel that they are not settling well in the culture, they've not been handholded, they've not been guided well. And that is how most of the organizations we've seen, people leave the organization initial 6 months because they are lost, they don't know what they have to do, they've not been guided well. Now again the question is whether the onus of responsibility lies only on nursing? No, it is everyone. It is the equal responsibility of HR, it is the responsibility of the doctors, it's the responsibility of operations. Each and every function in the organization takes equal responsibility of ensuring that a nurse joining the organization should be settling well in the system. And that's something which we need to be very strong at, and we need to have that strong commitment right from the time when a nurse is joining the organization. There are a lot of other activities and a lot of other tasks where nurses and HR work together. Very important aspect is the recruitments, because the bonding usually develop when both the nurses and HR go together, hire people, campus connect. Okay, so now the time has gone where HR used to take the inputs and then used to, what we used to do earlier. Okay, if nurses are saying get me 20 nurses and we are getting 20 nurses without understanding what the business dynamics are. Now we need to work closely with the nurses right from the time to understand that the kind of people, the quality of people needed for the business. Okay, number of nurses required in the business. And that is very much a decision taken by nurses and the HR together. So the bonding starts from that time when we hire a people, we strategize a number and campus connect, and we ensure that people who join the organization, that's a complete holistic approach of taking care of the technical and the behavioral skills, because both the skills play a very important role in getting the right and a fit candidate for the organization or a nurse for the organization. Apart from that, we've seen that, as I told you, that nurses generally don't leave only because of the better salaries. Nurses leave because they don't find that culture, they don't find that environment which they are looking out for, or where they feel that they can comfortably contribute to. So I feel that retention is a very much a responsibility of course, both nurses and the HR to create that congenial environment, to ensure their comfort level, okay, and to show them a career path. I have heard a lot of speakers were talking about the career path, career goal, but are we defining any career path? Again, these are all the questions which we are asking to ourselves, that where are we? So this particular slide doesn't say that this is what we are doing. This particular slide is giving us a thought process as to where are we today and what all things we still have to achieve. So retention is a basically a very challenging thing now in all the hospitals, because the way as 35%, 38% people are talking about, and everyone is talking about the nurses' retention. We've been coming up with a lot of things, lot of activities, but in despite of that, people are either not get connected with the organization or with the people who are working. So here the most important role is with the mid-level managers, as how are they becoming a buddy with the new nurses, and how are they taking the responsibility of ensuring that the nurses are settling well in the system. So that's something which we need to again think about and think as to what we have to do to improve ourselves. Learning and development now. This is another big thing which I have seen in this industry. You know, nurses सिर्फ कुर्सी भरने के लिए नहीं हैं. You know, if there is any event where we need to call 40 people, 20 nurses को बुला लेते हैं, because there are around 1500 nurses, तो 20-30 nurses को बुला लेते हैं. So they are not here to fill the chairs. They are here to understand. They are here to be told that what is this training or what is this occasion all about and what are they going to learn out of it. Also, I have observed most of the hospitals, they call nurses after doing their night shift. Is training a checklist? Ho gaya. My job is done. So a job of mid-level nursing managers are done, because if they are given a target of covering 30 nurses, theek hai, done. I have called all 30 nurses who have completed night shift. Results, I am not responsible. So please, training has to be taken up something very seriously, and moreover I think we have to think out of the box. All the trainings need not to be a classroom trainings. Why not we think about digitalizing our training programs, a mandatory program, so that we can give that flexibility to an individual to perform, to go through the training sessions. Why only the classes need to be arranged 8 to 9 so that you can have both the shifts? No, that would not going to give us the result. Training is going to be a pain for nurses than helping them out. There are various institutes, like ANEICON of course is one association. There are so many institutes, forums, where we as a nurse, where we as a HR, when we work closely with the nurse, we give this opportunity to youngsters to grow, to attend the workshops, attend the seminars and learn out of it. And most of the trainings, I must tell you, it should be on the job. It should not be done sitting in a class, because the nurses are now, they're already being trained for 4 years, 3 years. Various colleges, they come out, they don't need any classroom sessions, they need on the job training. So we need to think in terms of providing them on the job trainings. Employee engagement, we keep talking about employee engagement, that we are engaging our nurses. Of course, the objective of everyone is to engage our people productively. But are we really achieving that? Are we really able to do 100%? So what is the approach we need to think about? I feel that employee engagement is much to do with the overall development of an individual. What are the kind of projects you are running for the nurses? Are you running any management development programs for the nurses? Or nurses are allowed to attend only the nursing workshop? Why not the management workshops? We are not talking about elevating a nurse to senior staff nurse to supervisor in charge. We are not creating that hierarchy. We are talking in terms of a horizontal growth, giving them exposures. You know, most of the nurses, they come to the HR or any function, they say, Madam, मैं तो 4 साल executive था, अब now I have completed 4 years, you make me senior executive or manager or senior staff nurse. Is only a designation going to give a knowledge to you, or you will learn more if you are designated accordingly? No. So until and unless you've been given that information of the horizontal growth, giving that exposure to you in the organization, there will only be a vertical growth for you. And then you will again be, stepping up to the level of hierarchy, senior nurse, in charge, supervisors. But your goal is, again, we are talking about nurses. We are seeing nurses as a future CEO and the COO. We are not restricting our nurses only to the CNOs or the director nurses. They are the CEOs of the hospital, and I strongly feel, because the amount of commitment they have, the efforts they put, it's way beyond our imagination. Now again, another important factor which I have seen is the policy. If something is done for me, involve me. Why should I just take it for granted because you have told me? Please involve me. Any policies being just made for nurses and been told, ये बना दिया है, अब करो. Why? Are you not a part of it? I think even if the leaders are not informed, it's fine. But the input should be taken right from the junior most nurse who are there on the floors, who can give us the ground realities, who can share with us the perspective, the problems which they face. And that is how we can build one policy. Of course, the communication should go to the ground level. We in AIG also have a same challenge of not able to communicate to the to the junior most level.
Another 1 more minute, please.
Okay.
Anyways, I'll not take much time. So now here is something of the continuous learning and development, and I see that quality is a pride which we take in our task, and it should not be taken as a JCI and NABH accreditation. Now, how does it help an individual? How does it help a nurse? It gives us a sense of satisfaction and happiness. More than money, it is the happiness which makes a difference, and it motivates us to do better and better. Sense of accomplishment, it is something to motivate us to have a dream and strive hard to achieve that dream. Positive mindset, to have a positivity inside and outside. Great ideas, of course. When we work with people, we unlearn certain things, and we come up with the best of ideas. We are not restricting ourselves not to share or to be silent at the workplace, but to contribute, to speak, to share their opinion. And of course, when we have this bonding, we have the buddies, we'll be able to resolve our issues and grievances more comfortably. How does it impact an organization? So I think you are our recruiters, because you are the brand ambassador. When you go out, you speak about us. You are able to attract and retain the talent, because you are the ones who counsel the people. It is not done by HR alone, until and unless your support is not there. There has to be a system of transparency and efficacy in the organization. How would it build? Until and unless we have that bonding. Improvement, continuous learning and development, as I just told you, it's a culture. It's something where people are coming, learning, unlearning, relearning. That is the culture which we are trying to build in the organization. Equity and inclusion, people have spoken about the equity and inclusion. So I personally feel that until and unless you are involved, you will definitely not stay in any organization for more than 1 year. So people are leaving not because of better salaries. People are leaving because they don't feel that they are the part of system. These are few things which I will not take much time. I think this industry is still dominated by women as of now. We need to have that family inclusion in terms of any kind of programs. I would really feel bad if my daughter I would really feel good if my daughter would be called and would be, given the award if she scored 90% marks. I would really feel connected with the organization. And what if organization is appreciating me and sending my appreciation letter to my spouse, to my parents, saying that your daughter has done a good job? That's the connectivity, and that's the inclusion we are talking about. Of course, I have spoken about the emotional support, the hand holding. One most important thing here is providing a platform which is fair irrespective of caste, color, religion, gender, regional locations and socio-economic background. Again, in my previous slide, I just want to talk about two things, that sometimes this bonding creates a biased and unfair decision, because we usually take decisions based on the facts, not on our likings and dislikings. Also, we need to be little careful of the confidential information, that what all information should be revealed, what should not be revealed. So because of the interest of time, so this is a small video. I'll conclude my presentation with a small video of what culture and what buddy system we are trying to build in AIG. This is a small effort, we have just started now.
Thank you so much, Ms. Vasu, for highlighting on so many aspects. If we take the gist of the discussion which has happened right now, in terms of talking and in terms of involving, in terms of interacting with each other is very much important. Involving HR and HR is very open in making it sure that they come along with us in decision making. Town halls can give us a lot of understandings in terms of what a nurse is looking forward to. Their ideas can be then later on taken for policy making. We should definitely see that sort of an interaction is happening quite well. And when we are also looking at the KPI setting for individuals, both the skill competencies and behavioral competencies should be understood. Because going forward, the interpersonal relationships, the behavioral part of a human being is more important as they grow up the ladder. So this sensitivity should be given to the people in the system, and we should work together with HR and take all the possible benefits that we can give it to all our teammates. Right? Thank you. May I now take the privilege of introducing Dr. Anil Kumar Mulpur, Chief CT Surgeon, Apollo Reach Hospital, Karimnagar, Telangana. He has also been a cardiothoracic surgeon and a Vice President of Critical Care Services at Sunshine Hospital, a Vice President Clinical Director, Senior Consultant Cardiothoracic Surgeon and Vascular Surgeon at Narayana Hrudaya Hospital, Head of Department of Cardiothoracic Surgery, worked in Yorkshire Heart Centre in Leeds, UK. He is the only doctor in the country with FRCP and FRCF. So that's a credit to round, and we are so privileged to have you with you. And so many other credits along. We are very privileged to have you to understand this critical piece from a very senior consultant, because nurses do have a pain area when it comes down to clinicians. Very, very subdued the team is, because they never can open up a they don't have the courage to any time say back anything to the clinician. So over to you, Dr. Anil.
Sairam, and good afternoon to everyone. There is no doubt that since times immemorial, if somebody has a chance of writing the history of medicine, doctors and nurses were inseparable buddies. Buddies term may have come recently, but they were together in alleviating the suffering of human beings. In the pandemic, I have lost a few buddies, and I'm sure all of you have lost some buddies as well. Not here, but we have lost buddies across the globe, and therefore this presentation is dedicated to those nurses and doctors and other healthcare personnel who have lived and they have put their lives at the forefront when we never had vaccinations on the horizon, and they are no more. And may their souls rest in peace, and may their families be proud that their loved ones laid their lives in the call of duty. I see very senior nursing professionals here. It's a matter of pride that your parents have sent you this noble profession. And I keep saying this because now I see a difference. If I go to Fortis Mohali and I ask what is your name, there are cohorts there who are local Punjabi girls who are coming into profession, but otherwise nursing anywhere in the world was Kottayam, Kochi, Alappi, Alappuzha and so on. That's it. Now at least families have realized that nursing is a noble profession, and therefore all of you are sitting here. First, congratulate yourselves that you are in this great profession, and be thankful to your parents who have allowed you to choose this profession. Whether you are able to express eloquently or not, whether it is too late to change your profession or not, if you actually close your eyes and ask yourself, why am I in this profession? When there are so many other professions which probably at 10 plus 2 a counselor will tell you, why am I in this profession? Natvaham kamayet rajyam, na swargam, na punarbhavam, kamayet dukkhataptanam praninam artinasanam. Sanskrit after lunch is difficult. So I'll make it simple for you. Pronunciation is difficult, following is even more difficult. I am not looking for heavens. I am not looking for riches. I am not looking for kingdoms. I am not looking for wealth. Neither am I looking for freedom for birth, nor am I looking for a better birth. I am here with only one motto: Kamaye dukkha taptanam praninam artinasanam. I am here only to wipe away the tears and reduce the suffering of my fellow human beings. That is the only reason why we are in this profession, nothing else. Now therefore, as I said, term may have come recently, but nurses and doctors were together in reduction of this from historical times. So I call it yin and yang. In Chinese philosophy, they are inseparables. Now, if you look at, as people are using the terms ecosystem, in today's modern healthcare, where do we come together, doctors and nurses? We come together from the time a patient walks into the outpatient, so you have got outpatient nurses, there is somebody to take the vitals of a patient. Then there is an admission process, there is somebody who is going to tell them what are the patient's rights and responsibilities, though they always get confused about the employee rights and responsibilities. Then when they go to diagnostic, there is a nurse there to facilitate. Then either they go to critical care area or ward, there is a nurse. Then there is an operation theatre, and even post-discharge, there is a continuous interaction between the general practitioner, if you are talking about a system which is equivalent to NHS, and the doctor at a GP level, outside the hospital, to every individual area where nurses and doctors work together as buddies. Now if you look at our own time, whether you are a nurse or a doctor, 6 to 8 hours of your time is gone in sleep. 6 to 8 hours is gone in your non-professional chores. So you have got about good 12 hours where your reticular activating system is fully functioning and you are there with your professional colleagues. That is the best part of the profession, and that is where we run into each other as buddies every day and every night. Good old days, there were very simple equations in any hospital. You get patients, you have their families, you have doctors, you have nurses. Simple. Together you evaluate a patient, decide what treatment has to be given. Doctors, nurses, patients and families. Over a period of time, to affect our companionship, friendship or buddies, you have got now managers and investors. These managers are neither nurses nor doctors. So they have no clue about what is a GNM, what is a BSc, what is MSc. Therefore, they will never be able to relate to the ground hardships which a nurse is facing or a doctor is facing. And then there is an investor who has absolutely no clue how a hospital is run. I had the misfortune of sitting on the board of directors. I have no problem in telling the name of Narayan Hridaya. Kiran Mazumdar Shah was sitting next to me. There was one IIM chap who is an investor who cannot pronounce cash. He is investor. And in the meeting he keeps on saying after presentation, where is the cash? Where is the cash? Where is the cash? So just outside the room, they arranged a tea session and I went asked him, my dear friend, you just tell me about this cash, what you are talking about. Because nurses and doctors can't understand what cash is. And you are continuously saying, what does he say? He will say, where is my return on investment? And I said, what exactly you want as return on your investment? He says, whatever money cash I put, I want 3 times that in 1 year. I unashamedly told him, here is my suit, my trouser, give me one Vijay Karnataka newspaper, I will turn tight to my waist and go. Still, I can't give you that cash what you are looking. This is an operation theatre. Look the face of that poor doctor and the nurse. The patient is surrounded by case manager. And look at their waist size. Utilization reviewer. Because they want to see what is the operation theatre utilization, ICU utilization, bed utilization. Again, look at the waist size. There is a billing supervisor. There is one insurance guy who says why there is an insurance delay. And there is a discharge planner. Where is the treatment? So the best buddies, nurses and doctors are pushed to one corner, scratching their head, what on earth is happening? So my friend who is an IIM Lucknow graduate who keeps on saying cash, he talks about, unfortunately, we are all sitting in hospitals which talk about public offers, share prices, EBITDA. Dr. Devi Shetty was sitting next to me and he said, Anil, for the first 5 years I did not know the full form of EBITDA. Today I am very happy looking at 120 outpatients who come all the way from Bengal to me. I don't know what EBITDA is. That's the reason why I have employed all these jokers. Return on investment, and I told what is the expectation. Private equity. All these things are not there in BSc or MSc nursing. All these things are not there in MBBS or MS. Acquisitions and mergers. So this you are having as the best buddies, nurses and doctors. And what is this coupled with? If you want to look at government, extremely poor infrastructure, and I keep telling zero accountability. Ajita was saying by accident some government officials came yesterday. Thank God I was not there. It must be raining or very hot outside, otherwise they don't come. So you are now expected to have extremely good quality nurse education. I was just telling Subhada over the lunch, I will tell you how much money you have to get to me by evening. Any one of you who has got a cow shed, I will make you open a nursing college by today evening itself. Today evening. Don't ask me how much money where. You can take any number of students you want, no problem. Cow shed. And most of the seniors have agreed that they don't even need actually cow shed. Madam was telling me that there is a tea shop which was converted overnight into a nursing college. So from that you will have to get best buddies and you have to deliver tertiary and quaternary care. As my preceding speaker eloquently said, I have no problem in working under a CEO who is a nurse. Because they came from grassroots levels and they exactly know what a clinician's request will be or what a nursing student's request will be. Because they know, unlike the people we talked about. So, in this buddies, I keep encouraging my nurses, never stop with your BSc. I was so happy to see so many MScs and PhDs here today morning. Don't stop with your, worst is people are still going in for GNM these days. When you have got cow sheds which can give you BSc. So don't be happy with your GNMs, become BScs, MScs, then you are posted in wards, critical care areas, operation theatres. We talk about the so-called area-specific training and whatever, neonatology, pediatrics. There are so many avenues where the doctors and nurses can act as buddies and then get the quality to a great level. Doctors and nurses, though they are buddies, they have got a very important boundary. That boundary is either social, ethical, moral or professional boundary on one hand, but then we also have to understand that we cross that boundary when we talk about the emotional quotient. So this is where you are buddies, but we have got drawn lines. We are buddies, but we actually transgress those lines. What is emotional intelligence or emotional quotient? It is the ability to understand and manage your own emotions in a positive way to relieve stress, communicate effectively, empathize with others, overcome challenges and diffuse conflict. This is something which we see amongst buddies every single day. Unless I understand your psyche and you understand my psyche and I understand where you are coming from and why. We talked about absenteeism. We talked about people who are absconding. Why are they absconding? We just call them COVID batch. Why are they absconding? Why are they unable to come to terms with the realities of life? So, if you actually see the epidemiology, The reason why I said you will have to cross those boundaries is it pains me if a nurse commits suicide. And I'm sure all of you who are seniors have seen in your own nursing colleges, hostels, that there is one odd girl who has committed suicide. There is one odd doctor who has committed suicide. So if you look at the rate of suicides in female nurses, it is double the incidence of the general population. It is very easy to understand my buddy because of the stress which this girl is undergoing. So she said, at the end of your night shift, just because you want to have a pair of hands or you want to fill the chairs, you are calling people just to say to your clinician that you wanted one-to-one nursing in your ICU, I have got one-to-one nursing. But you are not looking at her stress levels and you are just pulling her because she is afraid and she has to dance to your tune. She is coming here. Don't tell me she is coming with passion. She is tired. She can commit a mistake. So stress levels are increasing, and one of the most important things which all of you should do as buddies is to see if they are actually going off the track, and if so, you make sure that they come back and you prevent this. And most important, I have put it in bold there, let buddies don't at least add to the agony. That is one of the most important take-home messages for you. Please don't add to agony. If you are unable to sort out, just keep quiet. Why are you making things worse? So at least don't make things worse for your nurses and doctors, because you are the best buddies. When they actually started sexual harassment committees, I always raise my hand, because that is where I thought officially from holding hands I can, hand holding to holding hands I can officially do it. They said, no, it is not sexual harassment committee, you are not going to be paid to harass sexually anybody, it is called anti-sexual harassment committee. Then I said, I've got better things to do in life. So, information, if it is coming from the so-called anti-sexual harassment committee, take it very seriously. And all hospitals have got big carpets. Don't push it under the carpet. Don't ignore those early signs where your buddy is coming and telling you that things are not going well. Otherwise, you'll have rapes, otherwise you'll have murders, otherwise you'll have absconding, eloping and whatnot. Indian nurses, I've seen one of the presentations where you are talking about the posture variation, and Tankam was telling she's only 37 kilograms once upon a time, and she was hoisting people who are 75 kilograms. So Indian nurses and doctors, when you look at the number of complaints which we give, work related is very less compared to the West, because I have seen the West as well. Look after yourselves. As a buddy, that's what I will tell you. Look after your families. There are unfortunately accidents. I have lost a buddy because of cancer very recently. She was one of the most amazing nurses. She never knew. She was diagnosed, and her nursing in charge is here in the audience. And we just lost her. So, and last thing which pities me is, there is a girl who is working for a decent hospital, and she comes to me and says, I don't think I can afford getting a normal delivery in this hospital. Can you believe it? She is working for you, for your hospital, and your policies will give you 15% or 20%, and that girl's salary I know, and if at all that goes into Caesar, she says, doctor, I just can't afford, I will go to an ESI hospital. I think it is a shame, and as buddies we'll have to make sure that you get reasonable care, but not only yourselves. I'm talking about the nurse here, I'm not talking about nurse's mother-in-law. Which probably she will say, I think ESI is a good place. So ensure that with your buddies you get health benefits. I lost this nurse, I said, people were pooling in money to educate their children. Can't you have a better system? Can't you have a better defined system in the hospitals where you know that such things can happen once in a blue moon, and are we immature or poor to look after their children? So those things, I think as buddies we should really take care of our own selves. When somebody wants to go abroad, teach them, try to give them training which is required for their English examination. Where is the barrier between the buddies? Can I take 3 more minutes?
Just half a minute.
Half a minute, yeah. So, the barrier I see is in language. Make sure that whether you like it or not, you definitely have to learn good quality English and Hindi to communicate. There is no other way. You need to have professional knowledge, professional attitude, and most important is you will have to evolve a system where you spend more time with your clinical nursing rather than documentation. And where should the nurses and doctors be not buddies? Vaijyaraja namastubhyam yamaraja sahodaraha yamastu harati pranan vaijyo pranan dananicha. Oh doctor, brother of Yama, salutations to you. Yama takes away only the life, you take away life and money also. So that is where we should not become buddies. And here are these two guys who are looking like, I don't know whether you have gone to Paradise to have biryani here. There are bouncers in black t-shirts. So these are the people who are now employed by hospitals for recovery. That means you are in the wrong institution. This is where I don't want doctors and nurses to be buddies. Just look at the number of people in the operation theatre. So therefore limit the number of people in operation theatres and critical care areas. And here, okay, who is the triple bypass guy and who is the hangnail guy? Look at the number of people who are handing over. And this confusion is there. Your IPSG, identification of patient, don't become buddies and mess it up. You can get into serious trouble every single day, every single shift if you don't identify your patient correctly. Na karmana, na prajaya, dhane, na tyage, na ike, na amrutatva anasuku. It doesn't matter how much of bank balance you have, how many people you are following, how many buddies you have. You need to have that element of sacrifice, and then only will make our lives better. Now, we said our nurses, our future. I say our nurses, it is the only hope for humanity. God bless you.
Thank you so much, Dr. Anil. So as a true friendship, it's not just about good days, it's also about ensuring that we correct the friend all times, right? So I think we heard a very, very good understanding in terms of where are the things at which we need to draw the lines and not be along with the clinician, and making it sure that we are also assertive and very clear in our communication. And as nurse leaders, all of us should give that courage to the nurse to speak up. Maybe the clinician joining in the system, immediately we can have an interaction. Because if the nurse understands what the clinician is speaking, it's very easy for them to speak back to them. So that small interventions can help us. Thank you so much again, Dr. Nanil. May I take this time to also introduce our third speaker, Dr. Sanjeev Sharma, clinical pharmacologist for Apollo Hospitals. He is an assistant professor for pharmacology and a medical advisor to ARI. We see a lot of applaud here. He is a Gold HMA Award for alerting the high alert medications, FICCI Award on medication safety, Share Your Glow Story Award for minimizing medication errors due to sound alike localized drugs in Apollo Hospitals, Best Poster Award in patient education category for Max Healthcare. 16 publications are called his record. I am very sure that this experience around here is going to help us, and there should be more questions on this part. We will have the 1 minute of questions, because pharmacy is something which is, when we ask for which is the department you would like to have the interdepartment meeting with, others are going to say pharmacy, first thing. So over to you.
Thank you. Thank you for the opportunity, and thank you, sir, for making my job easy. Really, that was an interesting one. Now, pharmacist and nurse, they play vital part in the healthcare team, and that is not only healthcare, medication safety, because medication accidents are real dangers, 7th leading cause of death. Unless we work together as buddies, this is the problem which will never be able to support. Now, how many of you know your pharmacist? Please raise your hand. Let me see how many buddies we have. Okay, quite good number, I could see. Now, pharmacists, what we can achieve by this budding system? Pharmacist and nurse, when together we support each other. Pharmacist basically does the dispensing part, look into appropriateness of those drugs, ensure timely delivery of the medication, and the nurse administer the medication. Remember, this is the last step in the medication delivery, and after that, if something goes wrong, nothing can be done except monitoring the patient and looking for this. But what we do, pharmacists? How many of you remember by this statement? your pharmacist. My pharmacy never sends medication in time. Can you raise your hand? Right? That is the universal statement you will get. Let me tell you other part of the story, what pharmacist says about nurses. They never send orders in time, they send in bulk. How I can deliver 10 medicine in 1 minute? You tell me, am I a human being or a computer? What do you think? It means something is lacking in us. We are not coordinating with each other, we are not understanding. Though we may know who is my pharmacist, but I don't know their processes, I don't know what they are doing. Something lacking in that. So first, one thing most important in any relationship, right? It may be relationship with your husband. If you don't communicate, it will fall apart. So communication is the most important thing in anybody's system, right? In any relationship plays an important role, and this communication should always be timely, it should be direct, it should be clear, concise. Pharmacists always say that this nurse doesn't tell me when the order changed, when the drug order changed, when the new lab came, I could not check, creatinine was high, I could not stop my aminoglycoside because of that. I am not there always with the patient, but nurse is not informing me. And nurse says that this pharmacist, he never comes out from the pharmacy, is always sitting in the pharmacy, right? Let me tell you, this is the buddy which we have to pull from the pharmacy and bring him on the floors. Can we do that? Yes. How many of you agree this? This buddy we need to pull from the pharmacy, and let me tell you, many organizations, they are coming out and they have started doing ward rounds. So communication, very very important. Nurses are biggest customer for the pharmacist, and their care level cannot be completed unless we coordinate with each other. And when he does the ward round, very very important, when somebody comes on ward round, don't ignore. What we do is, pharmacist is coming, somebody is there. We never ask them how to administer this drug, what should I monitor after giving this medication, what are those precautions for this particular drug I should take. How many of us ask these questions? Can you raise your hand? Are you asking this question to your pharmacist? I could barely see some. So this is the buddy, this is the help you can take, because we can't remember those drugs. He's specialist in this. Doctor will come for 10 minutes. I always say one statement. What is that statement? A good hospital and the great hospital, only difference is the nurses. Doctors are always good in the hospital, right? Their level is that. But it is the nurses level which change the greatness in the hospital. And how this can be done? When we start developing this buddy system. I cannot remember my pharmacology, I cannot remember all the adverse effect of the drugs, but there is somebody who reads day in and day out those adverse effects. Why can't we take help from that particular system? We need to have professional respect and courtesy by understanding each other's role. How busy, what are the busy hours of pharmacy, what kind of processes is having. Can I call him up and ask, this medicine is urgent for me? And pharmacists should understand these are rounds time and this is a stat medication I need to stand. When we understand each other's processes, that may make our life easy and give us really good thing. That's what I was saying. Asking right question about drug administration, monitoring is very and when pharmacist and nurse does the rounds together, look for the drugs, look for lab changes, look for change in condition of the patient, physiological parameter differences, that is the day my medication safety will go to the next level. Pharmacist, nurse definitely have a common goal. Doctors, nurses, only one goal, when patient can be better and go home. Pharmacist and nurse, only one goal, how I can make this medication very safe, effective, without having any medication errors in the system. we have to understand this order has to be given timely and time delivery, safe manners, safe monitoring, safe education to the family and physician. Then only, very important, one other method of achieving this buddy system is having monthly meeting with the pharmacy. Ask this pharmacist, have monthly meeting with them, periodic joint, discuss the issues what you are facing, have a session, look into that, how we can sort out this, take new initiative in these sessions, and this is the session where misunderstanding can go away and real buddy system may come. Until unless we start doing teamwork, very important, this teamwork only can reduce medication errors, and this, by reducing medication errors, we can do lot of saving, healthcare saving, and saving for the patient. Collaboration of nurses and pharmacists is very important for addressing these challenges, and both can come closer to each other by opening communication channel. This is another important, probably as a buddy system, what we can achieve together. This is the project some of the hospital internationally has taken up. I just want to have some of you, when you come back next year, do this kind of project together. If you have an issue of high readmission rate in your hospital, you can have buddy system between pharmacists and nurses. When patients get discharged, look into those patients where readmission rate are very high, define that problems, and now the nurse and pharmacist will call in the first week and third week. Nurse will check all nursing parameters, pharmacist will look into those medication related parameters, they will develop their own plan, educate the patient when to approach the hospital, what are those adverse effects. They can educate lifestyle changes, and worldwide this project, lot of readmission have been reduced by doing this. Why can't we take this kind of project together? This slide, busy slides, talks about what at first week and what at third week we should do. Like pharmacists can look into therapeutic duplication of the drug disease interaction, drug interaction, drug appropriateness, adverse drug reaction. In elderly people, there are drug which may cause high risk of fall on those people and complicate. Remember, whenever there is a readmission, it will increase the cost. Not only cost, mortality chances becomes very high. And this is the time when we can start educating patient and ask them to demonstrate back, teach back. Technique can be used in this particular. We can teach about lifestyle modification, when to seek medical attention, what are those adverse events when they can call and they can check. In nutshell, if you see pharmacists, they have experience, their soft skill and hard skill we need to utilize very carefully as a buddy system, developing that. And of course, what we have done, we sit in silos, we have created barriers. I become controller of my nursing processes, he is sitting inside controlling his pharmacy processes. Unless we break this, and always there is always difficulty when you want to do changes. Change is most difficult thing to happen, but once change happens, things becomes very easy after that. So we can explain, talk to each other, communicate, clarify those issues, and pharmacist not only sitting in the pharmacy, comes out, does the ward round. These silos are broken. Definitely we achieve good results. We can have clinical pharmaceutical activities. They will provide logistical support. They can do rounds with physicians, manage adverse event on the rounds. Nurse can ask any medication related queries then and there, monitor the patient. By doing all this activity, probably we can become best buddies and give best care to the patient who comes in.
Hang on, Dr. Sanjeev.